What's Gucci with the veterans, military? Today we're going to be talking about common VA knee disabilities, conditions in which you can file VA disability benefits for and receive compensation for. Let's get into it. So, first of all, we have ankylosis of the knee, which it awards 30, 40, 50, and 60% VA disability ratings. And it pretty much goes into, okay, how much of the knee cannot be moved. So you go from, 30%, which is still extreme, but it's the low end tier of ankylosis, all the way up to 60. So depending on your level of impairment and inability to move your knee joint at all, you're up closer to that 60% criteria. Moving on. There's two levels of instability that you can get for VA disability for your knee outside of all these other ratings. Pretty much you're using a cane, using a walker, whatever the case, something to help you walk around. So you're not able to walk on your own anymore. You have some type of assisted walking device, whether it be crutches, walker, cane, motherfucker, you riding a horse, whatever the case may be. Patellar instability as well. 10, 20, 30, 30% being the most severe. With this one, with patellar instability, we got VA rating of 10, 20, or 30. The biggest thing is with 30% is it being still an issue post-surgery. So post-surgery, you've had all your, your recovery time, and you've been walking or running around, and you're still having patellar instability. That's when they talk about the 30%. And then, if it's not as much crazy issues, it's going to be 10 or 20%. Moving on. Most popular one on the list is going to be limitation of flexion in the leg. The VA awards 0, 10, 20, and 30% for that. Now, whenever veterans are going in for CMP exams or just routine with their doctor, physical therapist, chiropractor, whoever's going to be treating them on their knee issues, on your knee issues, you want to make sure that they are recording limitation of flexion. Especially if you're trying to get the highest percentage possible, the highest VA rating possible for that specific leg injury. So, if you're going in, 2-3 times a month, you definitely want to establish this with your doctor, because prior to you submitting that claim, the VA, they're going to be taking this, they're going to be looking for this information in your medical evidence, as well as they're going to be looking for you to potentially go into a CMP exam and be like, hey, we don't want you crit walking in here, fucking doing backflips. No, we want you to come in here, how it is, let us know. You filed for an increase to your already service-connected knee issue. Okay, cool. What's the issue? Oh, well, it's service-connected at 0, but I think I should at least, at the very minimum, be 20%. Oh, why is that? Because I can't put my knee into flexion more than 30 degrees. Past 30 degrees. But you definitely want to make sure that you're recording this with your doctor. Get some notes, possibly get some photos as well. So a lot of veterans get 0 or 10% for this. Why? Because when they go into the CMP exam, sometimes the examiner tricks them. Sometimes they, I know some examiners are watching cameras. They got security people. They got eyes in the parking lot, eyes in the sky, big brother. Whatever the case may be, hey, if you have any limitations and you're trying to get the highest percentage for this, you want to make sure that you go into that CMP exam well prepared, ready to be evaluated, and potentially watched the entire time that you're going to be in and conducting that compensation and pension exam. Now, keep in mind, after you hit submit on that VA claim, you could always go to your physical therapist, or your primary care provider to record some limitations and issues that you're currently having. Build that medical evidence while you're in the VA claims disability process to alleviate just the VA having, okay, they send you to a CMP exam and that VA rater only takes that information into consideration. No, plus it up, baby. Moving on. Next, we got limitation of extension. And yes, veterans can be service connected for both, so as long as both flexion and extension are being affected by the disability. So, for extension, this is the moneymaker. Veterans can make anywhere from 0 to a 50% VA disability rating, depending on their, you guessed it, limitation of extension. So, Once again, just like I said before, you want to go into these CMP exams, making sure that you're going in there ready to perform what is needed. And during these examinations, I forgot to mention earlier, the examiner should be utilizing a gyroscope. It's pretty much a device that they're supposed to be utilizing when it comes to specifically range of motion, whether it's in your legs, in your elbow, in your hands, in your shoulder. Then they need to be utilizing this device in order to properly, record your ranges of motion. Because the difference between a CMP examiner eyeballing you could be the difference between getting a 50% or 10%. And a lot of CMP examiners, they like to throw out 10% because they think, oh, I'm an expert, I'm a doctor, I got my PhD, I'm motherfucking Dr. King. You know what I'm talking about? No, you ain't no experienced doctor, and no one's eyes is that calibrated to fucking know the degrees of how much I need to be getting when it comes to getting my 50%, baby. Fuck out the way, pull it out, move it on. A common issue with the thick veterans is going to be medial tibial stress syndrome, or aka shin splints. And you can get anywhere from 0 to 30% depending on your level of severity, as well as you requiring treatment within a year time frame. The levels do change. The only difference is from 0 to 10 and 20% and higher is 10% and below doesn't take into consideration surgery, as well as all the other treatment options. When it comes to 20%, they're talking about surgery in at least one lower extremity and conservative treatment, whatever that treatment may be. It varies depending on the person, as well as availability and location that you are in the States. 30%, you're going to need surgery in both lower extremities in order to receive that 30% max criteria, where the benefits at for shin splints. So, closing thoughts. I say, hey, if you have a knee condition, you're already service connected, or you plan on filing a VA disability for a knee condition, you want to make sure that you got the right medical evidence. You want to make sure that you're going to that CMP exam prepared. If you're already using a cane, a walker, motherfucking space, whatever the case may be, you want to make sure that you're going in there prepared. I say take everything in with that to that CMP exam. I always say that. Take a DBQ. Take in, everything you submitted for that, anything significant. As well as make sure that CMP examiner got the DBQ out, they got the gyroscope out, or however you fucking pronounce that name, and it's going to be the device needed in order for them to measure your range of motion. If you're going in there for any joints, arms, knees, elbows, specifically for the knee, you're going to be sit it down. They're going to be measuring your limitation of flexion, limitation of extension. They probably will tell you to stand up to test and measure your level of instability. That's a claim as well. And this could be a time for you to bring up any additional issues that you're having. So, just because you're going in there for a specific thing with the knee, it doesn't matter. It doesn't mean that you can't bring up other things that you believe should be service connected as well. Because when it comes to that CMP exam for the knee, or you can submit for multiple things when it comes to the same body system. You don't necessarily need to put in 200,000 claims for it. You could just do one claim, limitation of flexion, limitation of extension, or right knee, or if you get the bilateral factor as well, make sure you got that medical evidence. Make sure you have a diagnosis in both knees, both shoulders, both fucking elbows, whatever the case may be. You want to make sure prior to you even getting into that CMP exam, all your medical evidence lines up correctly, and you'll be ready to rock and roll where the benefits at. 100% permanent total 2024 year to dragon. Y'all know what I'm talking about. Hey, y'all like this type of content, let your boy know. Till next time, y'all don't fucking time this. This motherfucking Devo out, baby.